was placed under enhanced community quarantine, and the quarantine has been extended to April 30. How has the quarantine been so far? How effective has it been? And how can the country bounce back after the pandemic? We are now joined by National Task Force on COVID-19 Special Advisor and UP Executive Vice President, Dr. Ted Herbosa. Sir, good morning, and thank you for joining us here on CNN Philippines.
Good morning, Ria, and good morning. Thank you for having me here at New Day.
Sir, let's get right to it. Based on the research conducted by the UP COVID-19 pandemic response team, has the enhanced community quarantine been effective so far? And what is your gauge for this statement?
Okay, the UP team of modelers and bioinformatics experts, disaster medicine experts, looked at two things. They looked at the doubling time. We call it that the number of days that the virus would double in number, the people infected would double in number. And we saw a decrease from about six days of doubling time to 3 days. So apparently there's already that number of cases, new cases decreasing already. I think we attribute this to the enhanced community quarantine and all the other public health measures like wearing masks, social distancing, and hand washing. The other factor we looked at is really the case fatality rate. That means the number of people who are dying. Unfortunately, this is where we need to actually act because I think our mortality is one of the higher ones. It's at a 5.3% case fatality rate. It's still lower than the recorded internationally or globally. But I think it's the fact that we lack doing more tests. The examples in Korea show that doing more tests would make you identify all the possible cases that we should isolate. So I think we really need to ramp up testing, and I'm very happy that Secretary Galvez and the Department of Health also have identified this as the problem, as a key problem in our current battle with COVID-19. And I think we're ordering 1 million new test kits and another 2 million of the rapid antibody test kits. So hopefully in the coming days, we will be ramping up. Aside from that, the Department of Health with the Research Institute of Tropical Medicine has actually accredited about 13 PCR laboratories all over the country. This means we'll be able to do more tests, and we hope to catch more of these COVID-19 positives so that we can actually isolate them and prevent the transmission.
With the fact that we've only just rolled out mass testing this week, when do you think the Philippines will finally see the flattening of the curve?
Actually, we've started to see the flattening. As I said, the doubling rate has decreased. Even our number of people that recover has already surpassed the number of our patients dying from COVID-19. The reproductive number, this is a mathematical computation of how fast a virus will spread, has now actually decreased to about 0.65. So from a previous reported about 1.5 reproductive number when we were still beginning our ECQ. So I think with all the mathematical models, we're seeing a flattening, but we shouldn't let our guards down. I think we've seen other countries that had what I called a resurgence or a rebound even after strict measures. So I think the idea now is what do we do after April 30?
Right. So definitely, even though this is good news, in no way should anyone be thinking about violating the mitigating measures or start to relax about it. Some concern now out of Cebu. DOH Region 7 consider the whole area of a densely populated sitio in Cebu City as a COVID-19 infected area. So they're considering all 9,000 residents already contaminated with the virus. And they've actually stopped and halted the swab sample taking. And health officials there have basically just said they'll just wait for anyone to exhibit symptoms and then bring them to the hospital. Do you think that this was the right response to this situation? What should they be doing over there?
Correct. This is what we call a localized response. When you already have widespread community transmission, testing everybody becomes too tedious because our tests take a certain number of days, as far as 5 days to 7 days to get the results back. And if you already have community-wide transmission, it is better to implement very strong mitigation measures, really locking down a particular community or barangay. So we'd recommend the extreme enhanced community transmission that was implemented in some barangays here in Quezon City. And the idea of that is really to prevent the more transmission of the COVID cases in that particular community, and then identify immediately those with symptoms and isolate them from the public, from the community, bring them to the hospital for isolation, and then be able to test them and identify if their symptoms really are COVID-19. Another approach, which the president already endorsed, is in a community like that where there is already many cases, is to really do the rapid antibody test. It's the fast, quick blood test that looks at the antibody level. There
Mhm.
are some shortcomings to this test. It's not very sensitive, and it's dependent on what day you actually do the test from the time the patient develops symptoms. So these are the measures you can do. The other thing that I heard during one of the reports was Mayor Magalong of Baguio City actually combined his team of investigators with the epidemiologic investigators. So he said that in Baguio City, initially when they did their contact tracing, the epidemiologic surveillance unit, the health investigators, were only finding 30% of the contacts. But when they added the expertise of the police
I see.
investigators, those investigating crime, they increased it to about 70% of the contacts. So that's part of the success model of Mayor Magalong. Yes,
Mhm.
Rian.
All right, Dr. Ted Herbosa of UP, thank you very much. We appreciate your time this morning.
Thank you very
And those
much,
are the
Rian.